So this week we introduced the concept of reducing the intensity of certain exercise routines to make it easier to get you to get our patients, those who are interested, to get on the floor and work out to make the system stronger, not be worried about the exercise being too hard. So Dr. Peter Holst here, Middletown Health, Wellness and Chiropractic, with another opportunity, another solution for better health naturally. So how did you do it? Did you determine the level of intensity for the sit back and the plank? Were you able to make it such that you had a difficult time talking while doing those exercises? If you have, great. If not, I would encourage you to get into it and create your set. And in keeping with that, I would like to today introduce a third approach, a third exercise, a stretch to round out our week of making it easier. Okay, so I like to stretch before I work out. Sometimes I'll stretch a little deeper after I work out, but you can do it either way. I know that there's plenty of evidence that says that stretching beforehand, stretching afterwards is good. I've always found it better to stretch lightly before you exercise and then a more deep stretch afterwards. So one stretch that I like to do is a thoracic rotation. People ask me all the time, my back pops when I stretch, and this is one that is often the case. And my answer to that always is, if you're stretching and you get a pop, that's fine, but you don't want to rip it. You don't want to go back and forth really fast, really hard with, God forbid, a dumbbell on your back, a barbell on your back to increase the intensity. Those kinds of rotational stretches are not good for the thoracic or lumbar spine. A slow, methodical, deep stretch is good. If it pops, fine, but don't rip it. Don't go fast. All right. So rotation. Sit up tall and rotate to the side like this. Hold the stretches like this for 15 or 20 seconds or more. Optimally, it's best to do 30 to 40 seconds. And again, sit up tall, make sure you're not slouching, nice and tall. Rotational stretch for the thoracic spine. And again, you can do it once or twice beforehand, a couple of times after, a little deeper after. You can also do that routine on your back, lying on your back. Keep your shoulders down and rotate your knees off to the side. I'll show you that in a second. But the second exercise that we want to talk about today is knee to chest stretch. That's a good exercise to counterbalance the sit back. So with the knee to chest stretch, you're stretching the muscles in your lower back, and that's done again on your back, and you're just stretching your knees up to your chest, just like that. Just relax into this position. Hold this stretch for as long as you can, and while you're holding it, maybe you can feel some tension release in your lower back. When it does, you bring the tension up a little higher, but you don't want to bounce this, you don't want to jerk it, you don't want to go for the gold. Just a nice, firm, steady stretch, holding it for 3 to 5 minutes, looking for that release so you can pull it up tighter. All right? And as far as the rotational one for your thoracic and lumbar spine, you would do that in this position. Keep your shoulders down and rotate your hips off to the side. This perhaps might be more for your mid to lower back than your upper back. Not going to get so much of your shoulders, but again, another rotational stretch to add to your routine. So that's it for today. Create your superset. Find the intensity level that works for you so you can get on the floor and do those exercises and progress and get stronger. That's it for me today. Friday, May 7th, 2021. You have yourself an awesome weekend. I'll be here back here Monday morning at 8 a.m. If you need me, give me a call, 344-0444. You have yourself an awesome day and a great weekend. Take care.